Okay, so we were talking about dizziness and vertigo, and we were right before the break talking about benign positional vertigo, which is you attain a certain position and you become dizzy. And then we talked about orthostatic dizziness, which is not vertigo. It's just a temporary drop in blood pressure, and how the blood pressure guidelines have been raised if you're over the age of 65, and so have the average blood sugars have been lightened. Those guidelines have been lightened just due to the risk of falls and things of that nature, and certainly dizziness is one of those things. Medications are probably one of the #1 causes for dizziness, and if you happen to be one of those people who look at and read the information when you receive your prescriptions, you'll find dizziness and lightheadedness almost ubiquitous across all medications because they sometimes, it's such a normal phenomenon. But one of the things about benign positional vertigo and some of the other vertigos is that you do have a left and right inner ear. That inner ear is basically semicircular canals that are in 3 different axes, X, Y, and Z. And the beautiful thing about that is they give you the position where you are in the world around you and where your head turns. Now, when we get up at night and we are blinded because the lights are out, we're basically, our position in the world is a tactile one, meaning it's depending on our joints and our ability to navigate. So as we get older, we lose some of what we call proprioception, meaning the detection of where our joints are in the world around us, and those go through a special channel in your dorsal column of your spine. There are a lot of falls that take place, so it's always a good idea that if you are elderly is to turn on a light when you get up and move, because you're going to use your visual sense along with your tactile sense to get in the position of where you are in the world around you. So make sure you do have a night light or something that help guides you in your ability to move or navigate at night. Okay, so left and right systems, when you turn your head, they basically, there's a gel and the nerves in there, and they turn in different opposite positions. Now, your brain, those semicircular canals, do not have eyes to the outside world. So that being said, when you do turn, if for some reason the input is not exactly opposite to the brain, you're going to spin. The body is going to not be able to determine which side is correct and which side is incorrect. One side could be dampened, one side could be heightened in reference to the other, but that will cause a sensation of dizziness that occurs with that. And that's the most common cause for positional or benign vertigo. Now, there are other conditions that are useful in mentioning. There are what's called a cerebellar pontine angle tumor, a rare condition that cannot be diagnosed with a CT scan. It must be diagnosed with an MI, and those are things that MRI. Those are things that you need to see your doctor about, because when I have a patient that complains about chronic dizziness that is not transient, I will recommend they have an MRI to make sure that they don't have a little tumor sitting in the base of their skull, which can cause chronic dizziness. So that being said, now ringing in the ears, if you have decrease in your hearing for whatever reason, you were exposed to loud noises, things of that nature, and you get very quiet in a room, you'll hear this high-pitched humming sound. Some people confuse that with ringing in the ear. That is a condition of the actual blood flow passing by the middle part of the ear. The internal carotid artery runs right by the middle ear, and you can actually hear that humming sound, and that is the blood rushing through your head. And that's different than a whistling or a high-pitched, very, very, I don't want to say annoying type of, almost like someone turned on a squelch on something in a very high pitch. That could be caused by an acoustic neuroma, where you basically have a tumor on the acoustic nerve, and those do require radiation or gamma knife therapy to try and get rid of those. So I hope that explains vertigo for you. Dizziness, obviously, if you're in something that's spinning and turning, you will develop vertigo because your you're spinning your semicircular canals, and it gets out of handle with what your body can take with regards to those pressures. But if you're developing that, it's a good idea to see your doctor to get that squared away. There are viruses that can also cause vertigo. It's called vestibulitis. We won't know what causes it. Comes on suddenly, maybe associated with a cold, maybe associated with nothing altogether. And one of the things that I've used in my office that has been very useful, and people sometimes laugh at it, is 2 milligrams of Valium twice a day. Now, we all know Valium is a tranquilizer, and people, take it for whatever reason, anxiety and things of that nature. But at 2 milligram dosages, it puts a dampening on that input, that nervous input, and it will actually settle it down. And I have a lot of patients on it, and they do very well with that particular product. Of course, Valium has a stigmata associated with it that a lot of people don't particularly like, that like methadone being for heroin addicts and Valium being for someone that's anxious. But a lot of drugs have other purposes than what their intended purpose would be. So with that being said, see your doctor. There's Antivert over the counter, which is 12.5 milligrams. The prescription strength was 25. 12.5 is something that you can get. Some antihistamines work very well for that, like Benadryl and things of that nature. In order for an antihistamine to work on vestibulitis, it has to be able to cross the blood-brain barrier and get inside your brain to be able to have its effects on that. And the newer antihistamines like Allegra and I would say less sertraline. So if it makes you sleepy, it actually crosses the blood-brain barrier. If it doesn't make you sleepy, the non-sedating antihistamines probably will not be effective for dizziness and motion sickness like Dramamine and things of that nature. So they have to be able to penetrate the blood-brain barrier, which is a different barrier. It's a much tighter barrier. Not a lot of drugs penetrate that particular barrier across the vascular system of the brain. So pretty good discussion on those particular subjects, and thank you for the callers, Ray, and I think it was Charles. So one of the things I had been meaning to bring up in the show that I never really had a chance to talk about was MERS, and on that segment of It Makes You Sick, Middle Eastern Respiratory Distress Syndrome. I alluded to it briefly. It is one of those unusual rare diseases, kind of like Ebola, kind of like some of the other strange things that you hear about, and we are getting into the wintertime where colds and flus and things of that nature become more pronounced. People stay inside. And they did a study a long time ago where they took someone and they opened up their windows and they got it damp and it was cold, and they had them in their skinnies, which were shorts, and there was no increased risk of getting the flu by being exposed to the cold in the environment. And in reality, it's a viral attachment, meaning you have to actually get the virus in your body with a cold or a flu. So it's what you touch and you rub your face, and if you do those particular things, you implant the virus on those particular areas. If someone is coughing or sneezing in the wintertime, we tend to stay inside more, so there's more likelihood of getting exposure into that as virus particles are through the air. Some of them live a little longer, and some of them don't, but it's a good idea. Again, I see a lot of people, and I know I've said this on the show, they use those hand cleaners. If you're going to use those hand cleaners, please just use it on your palms. That's the part that you touch. There's a lot of good normal bacteria that are on your extensor surfaces of your hand that you want to repopulate your palms. Remember, we touch things like this. We don't walk around with hands down unless we're a dealer and we go like that, but and even then you're not touching anything. So this is where you want to concentrate, even on your fingertips, or if you palm things. I had a patient one time who worked out at Front Sight, and she was getting ammunition and doing things like that, and she developed a really very hard case of erysipelas or staph along her face, and every time she touched an old canister of or a wooden crate of ammo, she would use as hand cleaners. And so she was using him so much, she killed so much bacteria. And of course, it was cold, and then she was rubbing her nose because it was running. She was cracking the skin because of all the runny nose. She was allowing the staph bacteria to get underneath her skin and setting herself up for erysipelas. And you know, and these things that people get called spider bites in these big red areas, a lot of times you'll find people that are using hand cleaners too much, and these Purell things, and they actually select for the methicillin resistant staph or flesh eating bacteria, and that causes them to develop these spider bites. So it's definitely not a form of brown recluse here like there is in the deep south that causes those particular issues. So you can really be too clean. And if you are too clean, you invite the promotion of resistant bacteria, and resistant bacteria are tougher to treat. So if you're using these hand cleaners, taking antibiotics for a cold, you know, because you're doing all that stuff, you really may be setting yourself up for a super infection and make it very difficult for you to clear that. So be very careful. Soap and water has worked for years, and I would continue to use that as needed. It does work quite well. When we come back from the break, we're going to be talking about MERS. I have some slides that I had put up for that, and we will get into that issue. You probably may not see it much, but it's one of those diseases to be aware of. And when we come back, we'll bring those up. Thank you for tuning in for this show, and then we're coming up for the last segment. Thank you.